Thank you very much, Mr. Phaahla, for facilitating this briefing for this morning. And greetings to my colleague, Deputy Minister for Health, Dr. Sibongiseni Dlomo, the Acting Director General, Dr. Nicholas Crisp, and good morning to members of the media, the viewers and listeners at home. We are indeed very pleased that this morning we have an opportunity to talk to South Africans about the matter which has been dominating the news from yesterday, since the release of the Special Investigating Unit report relating to a matter of our department, a matter relating to a company called Digital Vibes. Firstly, I want to thank Excellency President Ramaphosa for deciding to release this report to public, as it's been spoken about for quite a long time, and it was quite timely that this time it be available so that members of the public and the media can be able to have access and scrutinize this report, which relate to a matter of communication contracts from the Department of Health, National Department of Health, relating to National Health Insurance media campaign, and also communications for COVID-19 pandemic. Our department has been inundated with public and media inquiries on the implementation of the report, of the findings and recommendations. But this has been largely based on what has been in the media. That's why we're very happy that today we can talk about something which is now freely available, so that now we no more speculate, and therefore we're very pleased with that. We have noted that there are serious allegations against a number of departmental senior officials, notably that of our Deputy Director General responsible for health regulations and compliance, Dr. Anban Pillay, who at the time of the awarding of this contract was the Acting Director General when the contract of communication was awarded to the company Digital Vibes. From our side as Ministry and Department, we have had a chance to review firstly the first investigation which was done internally by the Ngubane company, and also now that we have the SIU report, we have had an opportunity to look at this report. Let me just emphasize on the fact that while we had some communication before through what is referred to as referral letters, the actual full report we only obtained yesterday, and with us over and above the report which has been circulated, we're also furnished with also annexed documents. So yesterday myself and the DG, we received a thick file there which sitting next to me and Deputy Minister Dlomo. So that is the file which we have been studying yesterday and over the night and early this morning. That file contains the full information with annexures. So I'm just emphasizing the fact that there's a perception that maybe we've been just sitting on the report when we've had some access of some snippets where there's some of the matters which have been referred to us, but the full report and annexures we only got yesterday. So we've gone through these documents. Now this report and the documents indicate possible misconduct by 9 officials. But it's important to indicate that 3 out of the 9 are actually not in the department. One was previously in the department, our former Chief Financial Officer, but who has subsequently joined another government entity which reports to another government department. So out of those, in terms of this particular aspect of the report, there are 6 officials who the acting Director General has to take steps against. The other 3 officials are employed by, as I've said, other government departments, and the acting DG has already been in touch with their heads of departments to inform them in terms of what steps are we taking and what is expected, therefore, out of those who are in other departments. Now, that leaves us, therefore, with 6 officials who are implicated in this report, as I'll indicate later on, but when you add our DG, then it goes to 7. We are anxious to conclude the disciplinary processes as a matter of urgency to bring these matters to closure in order to have time to dedicate our time and energy and resources to the country's response to COVID-19 pandemic as we roll out the vaccination program. But also bearing in mind that as a department, our responsibility is not only in terms of the COVID-19 pandemic, but we have what is called a quadruple burden of disease, infectious diseases, non-communicable diseases, violence, the mother and child health, all those aspects of prevention of disease, looking after those who need admissions to hospital, providing prevention through other inoculations, other preventative measures. This is all what is primarily our responsibility. So we are hoping that we can go through this process such that it gives us space so that we can focus on our core business. By the close of business today, all affected 6 officials in the Department of Health would have been served with suspension letters. The acting DG has been working on this since yesterday. He's been also making sure that the affected individuals are actually informed. And as we were coming in, he just confirmed that in terms of starting the process of engaging and informing them of what is coming. He has already done that as of now. So what is left, the letters are already prepared. It's just handing out the letters before the end of business today. So the outstanding disciplinary investigations will then follow, and investigators have already been engaged, and they will then communicate with the SIU for further briefing. And also, it's already been indicated that they might also need further information from other sources within Treasury and other parts of government. So the number of suspended national health officials by the end of today will be 7, because as you will be aware that the DG, Dr. Buthelezi, has already been put on suspension. And just to explain how this works, DGs are appointed by the President in terms of the public service. So when there is an issue relating to Director Generals, it goes to the President's office. So that's why, because the President his office already had their full report, so they were able to start acting earlier and took the steps and informed us. They kept me informed in terms of every step, and finally arriving at a step where the DG has been suspended already. So by the end of business today, 6 other officials, and which brings them to 7. So as I've said, the acting DG, just to indicate some of the departments, acting DG Dr. Nicholas Cripps has already written to the DG of government communication, where one of the officials who's implicated, the other 3, is in that department. The Department of Agriculture, Land Reform and Rural Development, and then our former CEO is currently CFO, is currently the CFO of the Government Printing Works. So the acting DG is communicated with the DG of Home Affairs and also the CEO of the Government Printing Works. So to inform them on the steps we are taking, so that they can work with him to also take similar steps against officials who are implicated in the report. And the intention, therefore, is to explain to those departments the course of action we are taking and then give them an opportunity to work with our department to take the similar steps so that we can streamline the processes. It must be emphasized that disciplinary processes are an employer and employee matter, and and we follow the public service as governed by the Public Service Act and its regulations. The report does show that indeed whistleblowing is one of the very effective mechanisms in the fight against corruption and corrupt activities, and it plays a role in encouraging accountability, transparency, and high standards of ethical behavior and governance, both in our public institutions, but also, we hope so, also in the private institutions. So the blowing of whistle was taken seriously within our department and also institutions such as the SIU, and this stand taken by an individual and individuals and by subsequent witnesses has brought us to where we are on this matter. We fully understand the public concern and interest in this matter because it involves allegations of misappropriation of public funds in the middle of a major fight against a pandemic, the COVID-19 pandemic, which has so far caused the country substantial spending of unbudgeted funds, as well as costing many, many lives. We have already passed 87,000 recorded lives lost from this COVID-19 and also livelihoods. Thus, we are committed to do further studies on these reports and findings, recommendations, so that we study them fully and so that we can act on the outcomes over and above just the formal disciplinary processes. These processes will also be undertaken without fear, favor, or prejudice to any of the individuals who are implicated. We are also committed to clean governance, and despite the fact that this does make the situation, as you can imagine, in the department very uncomfortable. We're talking here about a big number of senior officials who are implicated, who work with all of us on a daily basis. But we take this very seriously, and we will tighten controls and ethical practices. We take seriously the evidence gathered by the SIU and have noted the view that there may be scope also for criminal charges. Though we are mindful of the fact that there probably further investigations may need to be done in this regard, and also knowing the approach of our legal system, that until somebody is found guilty in a court of law, they remain innocent. But we take cognizance, and that's why we are taking precautionary suspensions, because the allegations are very serious while awaiting the formal processes. So we know that we must follow the rule of law. The SIU findings will guide us in looking into the alleged conduct of officials named in the report and assessing the disciplinary steps, corrective and preventative interventions that will be required. We would like South Africans to have confidence in our public health system and in the integrity of hundreds and thousands of government officials and public servants, and especially in our space of providing health to the public. It doesn't help when there is a lot of suspicion on the people who must run this system. So we want to assure the public that we will do everything possible to correct this. Because we are conscious of the fact that there are many hundreds and thousands of honest public servants, both in our department and elsewhere in the public service. Many who go about doing their duty. If you speak especially in the health system, in our clinics, in our hospitals, everywhere, very honest public servants risking their lives on a daily basis. And this kind of development just demoralizes them. And it's our responsibility to bring back their morale and their trust. We'll address matters of integrity and of consequence management concurrently, and we'll make our decisions known as we go on. We will do so within the framework of the law, and especially guided by the Public Service Code of Ethics and also the codes of disciplinary action, and also within the context of natural justice. As I conclude, I would like to unreservedly tender our public apology to all South Africans for this very unfortunate and really, very devastating saga in terms of the confidence of the people in our institutions. And we would like to assure the public that we are going to thoroughly and decisively act and ensure that nothing is swept under the carpet. We acknowledge the impact of this on the image of our department, the Department of Health, especially in terms of our capacity to provide public services. So it's not just a question of image, but it's also a question of it's really done a very devastating impact on our own capacity. As you can imagine, we're just at the tail end of this third wave and looking forward to how we can stabilize the health system. We're also pushing on a vaccination campaign. As we speak to you today, the President and the Deputy President have given marching orders to all of us in the cabinet, ministers and deputy ministers, communicated with premiers that we must all put our energies over the next 3 days starting tomorrow to really, push the vaccination campaign, the uptake of the vaccination. So all of us are instructed by our leadership to be out there in the local areas, all of us in our district where we are allocated to ramp up the vaccination campaign. So the last thing really we need is detraction from that by this kind of a situation. But also just in terms of capacity, you can imagine we are doing this in a department currently where you have a DG who is on suspension. You therefore have to have an acting DG who has been a driver for the vaccination program. So he's got to be removed from that. And then we have a Deputy Director General who is also seriously implicated. As we speak, from when we leave from here, a few hours from when we leave from here, he will be out of office. We don't know for how long. He's got to face the allegations. We have about 3 other senior officials in the department and 2 on a more junior level. So all those people, are going to be out of circulation. And I can tell you that this happens at the time when already in the department, we already had a lot of acting managers, senior managers. We have as I said, the CFO had left. We have the acting CFO. We've got about 3 acting DDGs because one of the DDGs has long been seconded to the Northwest as an administrator of Section 100, and then other 2 DDGs left. So we've got a lot of, thin management capacity. So this is just, but we want to assure the public that notwithstanding that, we will feel the impact, but we will do our best to make sure that the services on the ground don't suffer immediately in terms of the fight against COVID-19, including the vaccination program, the support to our colleagues in the provinces in terms of making sure that the health system itself, that's what we're focusing also on, the capacity beyond just COVID, dealing with other challenges of health services. We're going to do our best to make sure that all this destabilization does not ultimately affect the capacity of the health system, the public health system, to deliver services. Thank you very much.